Hello, it's Deb from Global Travel and Medical again. I just wanted to touch on some health news, NHS news that is out on the media about the women with the mesh for pelvic prolapse, incontinence, that kind of thing, especially after childbirth. And these women had round about 2003, 2004, some mesh implanted into their pelvic region, and the mesh was there supposedly to support the ligaments that control the bladder and the vagina and the ligaments and muscles that suspend those organs. Okay, now there were problems with this mesh, and there was a brilliant surgeon called Professor Sahir El-Neil, and she found that women ended up in a bit of a mess in terms of pain and poor quality of life, and the pain was unbearable because this mesh was adhering to the muscle and the fascia of the muscle, which is where all the nerves are within the patient's pelvis. And this caused a lot of controversy for how it was implemented, how it was placed, the research and the issues around why it was done, whether it was tried and tested, etc, etc. Now these women are looking for compensation, and they're still waiting, you know, over 10 years, 14, 15 years on, and nothing seems to be happening. And the doctor that found the problems with this Professor El-Neil, she's had a medical license suspended because she's spoken out against the system. Now, I mentioned in one of my last videos about Lucy Letby, and there's a culture within the health service that is very, I wouldn't call it toxic, but I'd say it's unhealthy. It's an unhealthy culture, and it tends to exist. There's a culture like that within nursing, there is it within doctors and medicine, surgeons, hospital managers. And when all these cultures, these unhealthy cultures come together against somebody or against a group of people, it can make their lives very, very difficult, very difficult. Their careers can be suspended, they won't get promotions, they are ostracised, they have bad things said about them, they have their characters questioned, and life for these doctors can be very difficult, and nurses and anybody else who goes against the grain, speaks out, or finds something has happened to patients within that arena. And it brings me back to, you know, when the NHS first started, and Nye Bevan wanted something for everybody. But I think one of the things he never anticipated about this healthcare for all, for everyone, was what would develop within that system. And having all these professional groups, excuse me, and their unhealthy cultures brings down the atmosphere, the working conditions, and the quality of life for those staff. I think unless you've worked in the NHS and seen, heard, or been part of this toxic culture from wherever it comes from, you can grossly underestimate what it's like. I mean, we hear of bullying in schools, we hear of bullying in a work culture, in an office. Imagine that tenfold, because you've got patients to look after, you've got relatives to care for, you've got patients in distress. So all this psychological pressure, along with this unhealthy work environment, doesn't make for good patient care. Things can happen, people under stress forget things, errors can occur, surgical errors, all kinds of things can happen because those staff are under pressure. And then you add in a time target, you know, so many operations to be done in such an amount of time, And all this is put forward in the media. Oh, we did 60 hip replacements or knee replacements in 60 days or 6 days or whatever it is. But nobody looks at what's behind that. What was the staff sickness level? How happy are the staff in their work when they're working like a production line? Let's get them in, get them the joint replaced, and let's get them out again. Nobody's looking at the culture behind that. People are not commodities. We're not a factory. We're a service. That's why hospitals were a service, just like the police service. We were there to serve the public. And now, what with things going wrong with patients, the politics of the NHS, money going into the NHS but not going into direct patient care, but being pushed to other parts of the NHS, which we can come to another time. It just seems to be making this whole NHS culture even worse. Part of me has my own theory on this, my own personal opinion, that may be deliberate, but part of me thinks maybe it's because the NHS is now so big that these are the consequences of having a big system. Who knows? Anyway, I'll leave it there. Thank you for listening, and I'll come on with another video. Thank you.